एक बार फेसबुक लाइव पे कर देता हूँ मैम, फिर शुरू करते हैं हम लोग।
हॅलो
हाँ यस मैम.
सर, आपण सुरू करूया ना. वी शुड स्टार्ट. दिस इज
Yes,
लाइक
I'm sure.
हाय टाइम. We should
Facebook
start it
Live.
because after 1
Yes,
o'clock,
ma'am.
everyone will have their lunch time in various colleges. So I think we
Yes,
have to
ma'am.
start right now. Yes.
Yes. A very good afternoon to all. As we all were waiting for the Roganidan syllabus orientation, new syllabus, so many requests are we received on the Academy of Roganidan platform. So today, on this context, we are arranging the first lecture by Dr. Ujwala Pawar ma'am. Ma'am is currently working as professor and head of the department, Roganidan and Vikruti Vigyan department at Government Ayurved College, Nanded. Ma'am has total experience of 23 years, out of which UG experience is of 23 years and PG teaching experience is of 18 years. Ma'am has been PhD guide since last 6 years, and recently ma'am has been elected as Board of Studies in Maharashtra University of Health Sciences and Nashik. Ma'am has presented many lectures on national and international platforms, and ma'am has sent biodata of me her of 20 or 20 pages, but I will concise this as ma'am has many publications in peer-reviewed journals. So we are very glad to have Professor Ujwala Pawar ma'am for the first lecture on the syllabus orientation. Now I request Professor Ujwala ma'am to start her lecture and to guide us. Thank you, ma'am.
Thank you, sir. Thank you. Am I audible?
Yes, ma'am.
Okay. Yes. Thank you so much. First of all, good morning, all of you, and thank you so much of Association of Roganidan and Organizing Committee for giving me this opportunity. So thank you, respected Budetwar sir, respected Varshniya sir. Thank you, respected Dr. Deshpande madam, respected dear Zaikini ma'am, Dr. Kolhe sir, respected Kolhe sir. Thank you so much again for giving me this opportunity. Now, sir, please share the screen.
चलो मैम स्क्रीन शेयर कर सकती हैं आप.
Yes, yes, I will share this. Just yes. Now, is it visible, sir?
Yes, ma'am. Visible and audible also.
Yes, ma'am. Yes.
Yes. Okay. Should I start now?
Yes, ma'am.
Please, ma'am. You can start with.
Yes. Yes, sir. Thank you. Thank you, madam. Today's my topic is our laboratory practicals and activity. So, when I studied our entire syllabus, second year syllabus, so I noticed that there are some important terms like prepare, describe, perform, order, and interpret. Our entire syllabus, these terms are used again and again, repeatedly use these terms. So I studied and I noticed this. So then my next slide is, and these all terminologies which are used again and again comes under the domains like this. So when we studied our only laboratory syllabus, laboratory practical syllabus, there are only 4 domains which are used again and again. So first domain is affective responding. Second domain is psychomotor guided response. Third domain is cognitive application, and fourth domain is cognitive comprehension. These domains are used regarding, I'm saying just regarding about practical, our laboratory practical. So when I notice that whenever the student want to prepare, whenever there is the suggestion of preparation of patient, the domain is used affective responding. Then what is affective responding? Includes expressing opinions, showing interest, participant, and discussion. And it is a cognitive attitude. Whenever there is the term used to suggest patient's preparation, the domain is affective responding. There is a cognitive attitude involves which involve a person's belief, idea, or knowledge. And so the student should have the knowledge about how to prepare the patient and why they prepare the patient for that particular investigations and for that particular disease of diagnosis. So whenever the term use perform in our laboratory investigation, there should the domain used psychomotor guided response. So what is psychomotor guided response? The individuals follow instruction and performs task under the guidance. So whenever the instructor instructs the two student about laboratory investigation, then the students performs the task under their guidance. So this domain is again and again used for the perform terminology. Then third one is cognitive application. So whenever there is used word terminology, order and interpret, then it is come under the domain cognitive application. So what is cognitive application? The transfer theoretical understanding into practical use. So student should be know about the theoretical understanding. They should know about theoretical concept, and they transfer it into practical use. So whether this term used again and again used order and interpret, it comes under the domain cognitive application. And the fourth one is CC. It is a comprehensive cognitive compression. So what is the cognitive compression? Whenever there the term is used describe, then there is the student must grasp the meaning of information and then they summarize it in their own words. So when I studied the laboratory investigations, I noticed that these four domains and these four terminologies are used again and again in our syllabus. So if we concentrate or we focus on these four terminologies and these four domains, then it will be easy for us to understand our laboratory investigations. Now, these are our learning outcomes. I will not go for this because we all know, but just CO1, whenever there is CO1, it comes again preparation. I already elaborate the term. Whenever the CO2, it comes under describe. Whenever the CO3, again it comes under perform. Here student must perform that particular clinical examination or otherwise particular that laboratory investigation. Next one is CO4. Whenever their term use, whenever there is a learning outcome CO4, they should be able to order and interpret the laboratory investigation, that particular laboratory investigation with that particular patient or with that particular disease. So whenever the CO5 outcome is other diagnose the patient, it is comes under clinical reasoning because present the case and with clinical reasoning. Whenever there is CO6 outcome, it is just advancements in diagnosis regarding Vadi Vinishya, prognosis, practical. We know all these terminologies. CO7 also should be communicate effectively with patient or stakeholders. And CO8 is demonstrate ethics. We know all Sadhrutta. We already studied it in our Grantha. So now we will start our laboratory practicals. So if you all have our syllabus, then topic 8.8 our started our practical laboratory practical. So first slide is hematology. These are the practicals: hematology, biochemistry, microbiology, urine and stool. We all have these practicals. The student should perform these practicals. But whenever see again the CO3 outcome, CO4, CO5, CO6. My slide is, yes, just you see there is a prepare. Prepare means to suggest patient preparation. So student should be understand if they want to hematological, if they want to perform or they want to do for hematological investigations, they must know what is the preparation for that particular test. If they want to if student want to do just like hematology or biochemistry is in under biochemistry for sugar, then they should know if there is patient fasting, if there is patient, there is no need to fasting. If the urine collection, then how to collect the urine? Is it morning sample? Then why is it morning sample? It is morning sample. Is it midstream urine? Then why it is midstream urine? If the stool, if the in microbiology, if we see the malaria patient, if they want to do the sample collection or patient of malaria or filariasis, then they should be know whenever the sample collection will be taken in malaria regarding when the patient have shivering or temperature. If they take the sample that time exactly, then they should get the particular result or proper result. If filariasis, then midnight sample will be collected. So if they know the exact preparation of patient, so it comes under the prepare topic. Now second one is perform. So student should be know about the preparation of patient in hematology, biochemistry, microbiology, urine and stool. These are our laboratory investigations. So student must know how to prepare the patient, just not about patient, just they perform the sample collection in each type of investigation, whether it is hematology, biochemistry, microbiology, urine or stool. But should a student must know they perform the sample collection. So perform the sample collection, they should know how to collect the sample, whether it is for biochemistry, which are the biochemistry bulbs, which are the hematological bulbs, what are the anticoagulants used, what are the bulbs used. They should know each and everything about their sample collection method. And next is the order and interpret. So student should know why they order, how they order, and what they order. If they want to order hematology, then they should know why they order. If there is the patient of temperature, fever, so and they want to differential diagnosis, they want to do the differentiate the patient of fever, then they know is it malarial, then they should interpret and order whether it is MP, whether it is for Vidal test, whether it is for NS1, NS2, dengue, or whatever it may be. But they should know, they should understand what is the order, what is the order and what is the interpretation of that particular investigation and that particular disease and that particular patient. So this is the slide which suggests us student must know, they should be know the preparation of patient's preparation, then performance of sample collection, and what is the method, why they order, what they order, and when they order, and whether whatever it may be, it should be interpreted. So this is my first slide. Now second one is topic 9.9. This is the introduction of electrocardiogram, ECG, or different imaging techniques. Now it comes under CO3. Now CO3 is the perform. But here, electrocardiogram like ECG, X-rays, MRI, CT scan, these are different imaging techniques. So just student want to know what is the preparation. They know this, they know the patient's preparation, how to prepare the patient for ECG, how to prepare the patient for USG. If they want to do USG, then they should know there should be full of bladder. Then why? They also know. It is the order and interpretation. So they must know which technique should be used, which investigation should be used, why and when. So it is the order and interpretation. If they want to do X-ray, whatever it may be, ECG, X-ray, MRI, or other techniques. It comes imaging techniques, but they should know how to prepare the patient, and they should understand the given report. If we give them report of ECG, report of any X-ray technique, they should know how to read the X-ray. What is normal X-ray? They interpret the abnormal X-ray. So this slide suggests us the introduction of electrocardiogram, ECG, and the different techniques. Here, student not perform this investigation because we have no radiology. So this slide or this investigation just for preparation and order and interpret. Now next one is introduction to histopathology. These two slides, previous slides, it comes under desire to do. Now this introduction to histopathology. So again, this here is not a preparation, no performance, just only order and interpret the test for histopathology specimen. This comes under cognitive application. So student know the theoretical knowledge. What is cognitive application? Just we saw this. They know the knowledge, theoretical knowledge, and they just apply that knowledge in practical use. So student here no preparation, no performance, first just they order why they order, what is the interpretation of each and every histopathological specimen. They should know. Then 11.11 is the study of histopathology specimen. Now here are some topics: lungs, trachea, blood, spleen, lymph. These are the list of some specimens which are given in our syllabus. Here also student no preparation, no performance, just distinguish and describe. Now what is a distinguish and what is describe? So student must prepare, already prepared histopathological specimens are there. Student just want to describe. What is describe? Describe means they know the basic concept. They know about that knowledge. They know about that particular topic. Now just they want to describe, they describe that because they know theoretical knowledge, they know. Now they just describe us what is these slides, what are the specimens, and they interpret them. Now Retas Pariksha. Retas Pariksha comes under CO1 and CO5. Now Retas Pariksha, CO1 is our first learning outcome, and CO1 is the basic concept. Means Ayurveda, it is the morbidity occurrence of Ayurveda principles. So Retas Pariksha is our Ayurveda concept. So student should know what is a Retas Pariksha. It comes under cognitive comprehension. Again, what is a cognitive comprehension? Cognitive comprehension means they grasp the meaning of that particular pariksha. They know, they grasp, they get the knowledge, and then they transfer theoretical understanding into their practical use. This is the cognitive comprehension. So they know because that is already given in our Sanhitas. So they know what is, they know the knowledge, but they interpret or transfer it into practical. So this is the cognitive comprehension. It comes under desire to know, but they know all the parikshas about Retas. Now this topic is very important for us because here is the pathological investigations and observations, performance, everything is here. So our original practicals which are performed by students started from here. Now 13.13 pathological observations and interpretations and performance. Now first of all, this is our slide. Just a minute. Yes, this is hematology analyzer. We see the picture of hematology analyzer. Now, whenever the student do the hematological examination for HB, RBC count, WC count, hematocrit, platelet count, differential count, RBC, these all hematological investigations student should prepare. Already I say about it. So student must prepare. They should be able to prepare. They should perform each and every investigations on hematology analyzer or cell counter, whatever it may be. They must know what is flow cytometry technique, what is the mechanism of analyzer, what is the principle of analyzer. They should know. So this activity comes under preparation, under performance, and under order and interpret. All three terminologies are covered in this investigation. So student must know how to prepare the patient, how to perform this activity. Student perform these activities on hematology analyzer, whatever it 3-part, 4-part, no matter, but student should know about hematology analyzer, what is the technique of this analyzer, what is the mechanism of this analyzer. So these all investigations performed by students, and they must order and interpret. They should order, they should be ordered. They must know why, if the patient is about iron deficiency, then they should know what is the indices, what is MCV, what is MCSC, what are the increase, decrease, what is the PBS, what is hematocrit. They know whenever they want to do platelet count, when they do this investigation, when they saw if there is a ESR, then what is the condition of patient. They know, they should know, and they interpret. They must interpret and they must do the order. So these investigations comes under prepare, perform. Student should perform this activity on hematology analyzer, and they must order and interpret these all investigations which comes under hematology. So very easy. This is psychomotor guidance. Then we know what is psychomotor guidance. Psychomotor guidance is a physical activity. So it comes under perform, and it comes under this activity is in hematological investigation because they do the activity. So it comes under psychomotor guidance, and it comes under must. Now our second topic is please
She requested ಅಂತಲ್ಲ she begged ಅಂತಲ್ಲ ಅಂತ ಕ್ಲಾಸ್ ಎಂತ ಡ್ರಾಮಾ ಮಾಡಿದಾರೆ ಗೊತ್ತಾ.
Now our next topic is urine physical examination. Now we understand that urine practical or urine examination is very important for the student. So it comes under preparation, perform, and order and interpret. Every subtopic is there. Students should know the preparation of urine examination. When the collection of examination, when they collect the urine sample, how they collect the urine sample should midstream sample. They know each and everything. So they perform the urine physical examination through their visual method. No, they know the appearance, why the appearance is clear. If it is turbid, then why it is turbid. They know the colors, which is the normal color, which is yellow. If there is yellow color, then why? Is it for jaundice? If red color, then is it there some blood in urine? Then why? They know, they order and interpret their report of urine physical examination. They know visual method. First of all, they do the visual method, and then they urine physical examination also. They do the physical examination of urine, chemical examination of urine, and urine microscopy. These all three examinations comes under urine, and student perform these all examination. So they prepare the patient, they perform the urine physical examination, urine chemical examination by their dipstick method, and urine microscopy also. Why they perform? Because they know about why there is epithelial cells, why there are RBCs, what are leukocytes, what are the cast, what are crystals, and why they present in urine, patient's urine. So they must know to order and interpret. So interpretation is must for this test. So this test comes under perform, prepare, perform, order, and interpret. So students should perform this test. So this is about urine test. Now, now we come for biochemistry test. This is the liver function test. It comes under cognitive application. So here is no for biochemistry test, student should not perform the test. Whenever there is biochemical test, student not perform the test, but they should know the how to prepare the patient for biochemical test. They should know, and they should be order and interpret that particular test, that particular investigation to that particular patient and that particular disease. They should interpret, but they do not perform this test. So they must know what is the interpretation, why liver function test will do, what is the patient, which sign and symptoms are there, why bilirubin, why direct bilirubin, SGOT, SGPT, each and everything comes under this terminology. Student must order and interpret. They know, they should know why they will test for this patient, why, when, and what they know about it, order and under order and interpret. So now next is liver function test. It is just demonstration. It CO2 under comes explain the principle and mechanism of functioning of biochemical analyzer. So just we demonstrate the LFT in our analyzer, biochemistry analyzer, and we can demonstrate them what is biochemical analyzer, what is the mechanism of that analyzer, and what is the principle of that analyzer. It also comes under cognitive comprehension, a desire to know, but I think a student should know the test about test. Now, next one is renal function test. Renal function test is also, there is no preparation, no performance. Of course, preparation is there because they should know how to prepare the patient, but there is no perform. Students should not perform this test, but they should know how to order and how to interpret the test, that particular test, what is urea, what is creatinine, whenever it is decreased, whenever it is increased, and in which patient, what are the signs, what are the symptoms, because it comes under cognitive application. So they know that theoretically, they know that knowledge, they just interpret and they convert it into practical knowledge. So this term, renal function test, is also comes under the order and interpret. Now diabetic profile, it also comes under again cognitive application. So student not perform this investigation, but they know what is a diabetes, what is blood glucose, what is HbA1c. They know about each and every insulin, C-peptide, whether it is diabetic patient, non-diabetic patient, pre-diabetic patient. So student should know how to order and how to interpret this investigation again for that particular patient and for that particular disease. So this comes under again cognitive application. Now next one is thyroid profile. Again, student not perform this case, this investigation, but again they know what is thyroid, what is TSH, what is T3, T4, T5, just whatever it can be, but they know, they should know about it, and they should describe, because describe is CO2. They know the basic concept and then they demonstrate. We will demonstrate them this test. They must know how to order, when to order, and why to order, and they should interpret their orders with their particular patient and that particular disease. So student not perform this test, but just they want to order and interpret. Next one is lipid profile. Again, lipid profile comes under cognitive application. So student not perform here, but they should know what is lipid profile, The preparation of lipid profile, the patient should be in fasting state for 13 to 12 to 13 hours. They know, yes, what is cholesterol, what is HDL, what is LDL, what is triglyceride, which is the good cholesterol, which is the bad cholesterol, which test is good or bad. They must know. So again, this investigation comes under what is the order, why they order, when they order, what they order. And if they order, then they should interpret their order again that particular disease, that particular patient, that particular investigation. Next is malaria and microfilaria. So here this slide is in our laboratory. Again, student not perform this test, but they should know what is peripheral smear of malaria. The schizoid are there. They know how to look, how to prepare the slide. They know. They should know about this slide. What is malaria? What is the sign and symptoms? And what is the investigation of malaria? They know. So again, it comes under order and interpret. Again, microfilaria, microfilariasis. If there is patient, not patient available, no issue, but they should know, they should order and interpret the given reports of malaria, filariasis to that again particular investigation, particular patient and particular disease. So it comes under order and interpret, and they should describe. Again, it comes under describe. Describe is the, they know the basic concept. They convert their knowledge into practical use. So they should describe that point. Now next is serological investigation. Serological investigations comes under, these investigations are performed by student because these are the qualitative investigations by slide method. So students will perform these investigations. It comes to RF factor, Vidal, VDRL, ASO, CRP. And here also student order and interpret. They must know whenever they order, what is the interpretation of RA factor, whenever they do the RA factor, whenever they do Vidal, why they do Vidal. If there is the inflammatory condition, then they know about CRP, they know about ASO titer, each and everything they know, they understand, they should know. So this test about serological test comes under qualitative method. They perform the qualitative methods of this test, particular test, and they should order and interpret this test. Now, next one is stool examination. Here also, students should know how to prepare the patient. They should suggest the preparations to the patient, but student not perform this test. Again, student must know, they should be order and interpret the stool examination. Then we will do the visual method, by visual method, and they describe the stool examination, because what is the color, if the change in color, then why the color changes, if there are ova, cyst, pulses, then why there are ovas, why there are pulse, if there is any infection. So student must order and interpret the stool examination and stool microscopy also. We see already urine examination, urine microscopy. Here is stool examination, stool microscopy. The difference is one, student perform the urine microscopy, perform the urine test. Here stool examination, student not perform this test, but student should order and interpret entire stool examination and stool microscopy. Next is semen examination. Again, student not perform this test, but they should be know about how to order, why to order, and when to order, and they know the interpretation of this test of semen examination by visual method, and they describe semen examination procedures through demonstration. Yes, they know what is the method of the semen examination. They not perform, but visually they demonstrate. Now, semen examination microscopy also, because they should know what is the semen, what is the count, what is the motility, how is the motility, what is the color of semen, liquefaction time or viscosity, the morphology of sperms, motility of sperms. They should know. So we demonstrate them microscopy examination, but they should know how to order and how to interpret that particular semen examination for that particular patient and for that particular test. Now, last one is coagulation. So BT, CT, prothrombin, it also again comes under cognitive application, and student just prepare and order and interpret. Again, they should order, they should know how to order and how to interpret the BT, CT, and prothrombin, because we know whenever there are surgeries in surgical conditions, we should know. Then student know about it. They should understand what is the importance of bleeding time, what is the importance of clotting time, and what is the prothrombin time. So this is just about our practical. I'm trying to elaborate in simple terminologies. Now the activities, we should start our activities. Now our first activity is survey. Yes, our first activity is survey. Then student will take minimum 5 cases of survey. There is a very short pro forma for the survey. A student will take only minimum 5 cases for survey. Here, if we see in our syllabus, then the survey point comes under only assessment of dosha. So there is very important to assess the dosha vikriti. So the format is very short. MVHS will put on our website. But there is very short format, only name, address, age, gender, occupation, then assessment of dosh, which dosh vikruti is there in that particular patient. If there is kshaya, dosha kshaya, if there is dosha vriddhi, if there is dosha sansargaja dosha, sannipataja dosha, if leena dosha, sthanasya dosha, or marga dosha. It already given in our syllabus. So just students will take minimum 5 cases of survey, and they will only assess the dosha vikruti and agani. Sorry, also agani. What is the state of agani? Just within minimum 5 cases, student will take for this activity. Now, second topic is our second activity is creating video presentation. We will make the groups, whether 5 to 10 students of group, and each group present their topics. Now the topics are also given in our syllabus, that is Dhatu Paka, Ojadushti, and Asat. If we see, these 3 topics are regarding our Ayurveda, and then immune pathology, cell injury, adaptation, inflammation, hemodynamic disorder, and neoplasm. So the student will take any point of view. Only they will present their video presentation only for 5 to 6 minutes. Yes. They, after understanding the basic concept, what are the basic concepts? Dhatu Pak, Ojodushti Lakshana, and Asatma, hypersensitivity. These are our basic concepts. So after depending or focus on this basic concept, they will creating video presentation. They should present by video presentation the cell injury, what is adaptation. They will take just small groups, and they will take small topics, just like cell injury, adaptation. Then one group will take what is atrophy. One group take another, what is inflammation. Just definition of inflammation, mechanism of inflammation, what are the hemodynamics order. Just one group will take thrombosis, group will take shock. There are many small points in all subtypes. So they will take any point. Otherwise, they will present their video on any scientific article or they summarize any article and they will present, no issues. So this activity depends upon creating the video presentation, and the students will submit their video presentation in our department. Now next activity is class presentation. Now what is class presentation? Student, again here we will make groups of students, 10 students, and students will present their topics in our class. 10-minute PPT presentation and discussion. We will give them 10 minutes. So they will prepare their point. Now infection and nutritional disorder. These are the points of here. Just a minute. Yes, they will. They will take the topics like infection and what are the nutritional disorder. Very short point, they will present their topics in 10 minutes and 10 minutes for presentation, and after that 5 minutes for questioning and answer. And the topics will given infection and nutritional disorder. Very simple activity. Then fourth activity is our digital health and artificial intelligence. Now, what is digital health? Digital health is the use of technology in our healthcare. The thing is there, just digitally, we will take our cure or prevention in healthcare. Then the use of technology in our healthcare, when the technology is connected with the healthcare, like computing platforms, connectivity, software, then sensor, then this is the digital health. Application in general, wellness, application as a medical. Now what is, yes, I will, yes, this is the digital health. Now what is wellness? If there is wellness, M-health, mobile health, telehealth care, remote monitoring, wearables devices, visualization. These are the connected, these are the points in digital health. Now, what is wellness? Wellness is what? It is just about more than just physical health. Most models of wellness include at least 6 dimensions. What is physical, mental, spiritual, emotional, social, and environmental? If we see these all points, this is the wellness. Now, M-health. M-health is the term, it is a general term for the use of mobile and other wireless technologies in medical care. We know we use other wireless technology just like stethoscope, sphygmomanometer, glucometer. These are all wireless technologies which are used in our healthcare. So mobile health is not only mobile, but mobile means mobile is also there, but it is a general term. Mobile means M-health means mobile. Mobile means the wireless technology which are used in our medical care. So M-health, wearables. What are the wearables? Health monitoring devices worn on the body, such as we wear the watch, digital watch, stetho. That all technologies which are monitoring devices and which are weared on our body. It comes under the wearables. Now, what is artificial intelligence? Artificial intelligence, it is just used in, what is artificial intelligence? It provides opportunities to help reduce human errors and assist the professionals and staff and provide patient services. We already use artificial intelligence in our healthcare. In radiology, what is artificial intelligence? We use MRIs, X-rays, CT scan for identify the abnormalities. This is the artificial intelligence in the radiology. In pathology, we use microscope for analyze biopsy slides and identify for classification. This is artificial intelligence. In cardiology, for angiography, angioplasty, this is artificial. We artificially reach in our body and we diagnose the patient, diagnose the disease. This is the use of artificial intelligence in healthcare. So there are many examples of artificial intelligence which are used in our technology, which are used in our healthcare. Now, fifth activity is demonstration bedside. Here methods of Rogi Pariksha. Now, what is Rogi Pariksha? We know Rogi Pariksha is the soul of our Roganidan. There are many parikshas, Trivida, Shadvida, Chaturvida, Ashtavida, all that pariksha. So this activity depends upon demonstration, but bedside and simulated patients, or just like patient. Minimum student will take minimum 5 cases of this demonstration bedside. So students should observe. First, the instructor do the same, the examination. Then the student observe that examination, then receive that examination, they understand that examination, and then they imitate the same. This is the demonstration method, and it is applied in our Rogi Pariksha. Student should take minimum 5 cases on simulated patients for this activity. Now, next activity is a demonstration. Now, what is here Namaste portal, demonstrating the operations of the Namaste portal. Then what is Namaste portal? If I see the Namaste portal, the observation and implementation of reporting technologies and diagnosis. What is Namaste portal? If we see the Namaste portal, it is National Ayush Morbidity and Standardized Terminologies Electronic Portal. Students should know about it. They know because in our Namaste portal, there are some codes for the diseases, some definitions which are standardized, standardized terminologies are there. So students should know what is Namaste portal. So there are for the example, these are the codes. Yes, here are codes. SAT A, SAT A1. Yes, you see in this slide. So these are the codes. Different codes are there, and so student must know. Actually, just student know about Namaste portal. They should observe this portal, and they should know the upgraded terminologies which are given in this portal. Just like this, now the definition. What is the Ayurveda? If word Ayurveda, then the short definition is science of life. Then there is the long definition, science, where advantages and disadvantages, happy, unhappy along with. So Ayu, what is Ayu? Life, lifespan. Then combination of the body, sense organs, mind and soul. Then there in our Namaste portal, Ayush developed this portal for the definitions and the diseases, and the codes are given. So students must know about this. Actually, this comes under the topic Vyadhi Namakaran. Actually, Namakaran, Vyadhi Namakaran. We know all the Vyadhi with their names in our Granthas. But now here, the upgradation of terminology, standardized terminologies are given in this portal. So students should know what is Namaste portal and what are the terminologies and what are the definitions are given in that portal. Now, next is seventh activities to perform relevant clinical examination. Now, there are many topics given in our syllabus, page number from 71 to 75. If we see the activity 7 and activity 8, then we will merge the activity 7 and activity 8. The both activities, if we merge, then we there is also a short pro forma for this 7th and 8th activity. Just name, OPD, IPD number, date of submission, symptom. These cases, student will take the cases of each disorder, at least one case of this each disorder. There are many disorders where the syllabus, you see in syllabus, there are many disorders. I think there are 54 to just like 55 disorders given in our syllabus. So student will take the cases by each disorder on simulated patient. And there is also very short pro forma. Student they want examine only clinically examinations will be done only for that systemic exam, for that particular system, only for the Vikruta Strotas, for that particular disorder or that particular disease. Student will take the cases only regarding that particular Vikruta Strotas. And in 8th activity, they given the lab report and they interpret their lab report. They order for their lab report and they so we merge the activity 7 and 8 because the points which are given in syllabus are same. 7.1 to 7.5, all disorders are same in point 7 and point 8. If we merge them, then in 7, students will clinically examine the patient. They will clinically see the patient and only the Vikruta Srotasa Parikshan they will done. And in 8, will do the lab report and that they interpret that lab report. So I think we will merge 7 and 8 activity. Now, this activity is a problem-based learning, PBL. Now, what is PBL? It comes under also peer learning. Here also we group each maximum 10 students in each group. If there are 2 groups, A group, B group, then 10 students here, 10 students here. Now, what is the outcome of this problem-based learning? What is problem-based learning? Because it also comes under peer learning. So what is peer learning? Peer learning is a open-ended problem solved condition. If, for example, just to give one example, if there are one group of students or one group of just students, if there is one area and there is no water, drinking water, there is problem of drinking water, then 10 or 15 students come to each, they pitch their ideas, they plan for any business, for a plant, a water plant, and then the problem will solve in that particular area. So this hello. हाँ सर.
हेलो. हाँ मैम, डिस्कनेक्ट हुआ था शायद.
हाँ सर, काय झालं?
हाँ, यू कैन कंटिन्यू.
क्यों?
डिस्कनेक्ट हुआ था.
Yes, yes.
हेलो. Screen is not
Yes,
visible,
yes.
ma'am.
Which screen? My PPTs are not visible.
PPTs are not visible, ma'am. Please.
Yes,
Share
I will
again.
share. Yes,
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 ma'am.
sir, I will share the screen. Yes. Can you mention? Yes. Sir. What happened? But
Some network issues, ma'am, sometimes.
is it visible, sir? Now? They are visible?
Yes, yes.
No, ma'am. Not yet. मयूर सर,
But
आपका
I
हो रहा है
shared the
विजिबल?
screen, sir.
PPTs नहीं हो रहा है सर.
हाँ हाँ, PPTs नहीं हो रहा है.
एक
नेटवर्क
minute.
बिट कम दिखा रहा है मैम आपके साइड से. अभी आ रहा है थोड़ा सा.
आ गया सर.
यस मैम, अभी विजिबल है.
Yes.
यस.
Yes, sorry for inconvenience. I don't know what
टेक्निकल
happened. Yes. Yes, yes. We are talking about ninth activity, and it is a problem-based learning. So I will again repeat. what is problem-based learning? Problem-based learning comes under peer learning. So what is peer learning? If the students will make again the group of students, 10 students are there, and they teaches to each other. Because when students teach to each other, they learn, they understand what is the problem, what is the whatever it may be, the topic, the problem, the what is the difficulty. But first of all, they learn, they understand, and then they solve the problem. So about problem-based learning, about presentation, whenever we make the 10-student group, they help to each other. They understand it at their level. So this is student learn such even by instructor in groups and teach each to other, and this is the intended problem discussion. And so here, am I visible, sir?
Yes, ma'am. Slides are visible, but your voice is breaking sometimes.
My
Hello.
side. Yes, only one activity is left. Yes, there is only one activity, role play. Our next activity is role play. May I audible?
Yes, ma'am, you are audible.
Yes. Okay. So our ninth activity is problem-based learning. It depends upon the differential diagnosis. So we will give one topic. These is for one group. For A group, we will give Pravahika for second group. When one group teaches TSR to other group, or when other group teaches Pravahika to one group, I think this is the very healthy discussion, very healthy teaching, and the outcome is also very healthy. So what is the problem? What is the problem-based learning? It comes under learning. So here also we will
Just a minute.
मग काय झूमचा नाही अनलिमिटेड आहे सर एम आय ऑडिबल
Yes, ma'am, you are audible.
yes and slides
Slides are not visible, ma'am. Please share the screen again.
okay I will share yes I will share actually already shared I share my
Actually, थोड़ा सा नेटवर्क का इशू आ रहा है शायद मैं मुझे हाँ यहाँ पे आपका दिखा रहा है कि नेटवर्क पूरे बैंडविड्थ स्लो
नेटवर्क सपोर्ट कराते now
yes ma'am.
yes yes now the last second last one activity is role play. We know what is role play because all it is a scenario based. So all scenario present in front of us. So here also we will make the groups of 10 students, and the students will the topic will be selected from page number 78 to 80. The topics are given to us in our syllabus. So again we will group our students and the students will play role play, and each and every scenario is present in front of us. So students understand, they receive very healthy and accurate information about from the role play. And now the last is next week nahi. Now the last activity is our visits. Yes. Now the last activity is our field visit. So field visit, there are two field visits in pathology laboratory and diagnostic imaging center. And first visit is pathology laboratory and the second visit is diagnostic imaging center. So students should record the observations and submit the report to the department. So this is our last activity. And I think I complete my topic. Here completed all laboratory investigations and all the visits. If anyone have any question, then ask. I'm trying to simplify in my perception.
Yes,
I
ma'am.
don't
Thank
know
you.
whatever it may be, but just I'm trying. If
Thank you very much,
anyone
ma'am.
have
Very apt and descriptive lecture by Ujwala ma'am. I request all the participants, anyone has query, because actually ma'am has elaborately described all the syllabus points. मैम को जो भी असाइन किए थे वो सब हुए मैम ने जो दिए थे। बाकी इसके बाद भी हमारे 4 से 5 लेक्चर होने वाले हैं। पूरा सिलेबस हम पेपर 1 पेपर 2 एक्टिविटीज का मैम ने कर लिया, प्रैक्टिकल का हो गया है। थोड़ा सा भी दिवाली वगैरह वैकेशंस और बाकी की व्यस्तता के चलते हमने ये किया कि जो अवेलेबल है यानी जिनका हो रहा है जल्दी तो उनका करवा लेते हैं, लेकिन नेक्स्ट लेक्चर्स विल बी विद सीक्वेंस पेपर फर्स्ट देन सेकंड एंड अदर एक्टिविटीज आल्सो। अगर किसी को कुछ पूछना है या कोई क्वेरी होगी मैम से तो आप पूछ सकते हैं, अभी भी पूछ सकते हैं या मैम को फिर आप ग्रुप में पूछ सकते हैं।
Hello,
Yes.
good afternoon, sir.
Good afternoon, sir.
Yes.
It is Dr. P. Subramania calling from Karnataka Ayurvedic Medical College, Mangalore.
Yes,
Yes,
sir.
sir.
Thank you, madam, for a very wonderful presentation. I
Thank
thank
you,
the
sir.
academy also. Madam, one slide was
Yes.
missing on the multi-stick, that is on the
No,
urine
sir. Yes, I have the slide.
examination.
No, yes, no, sir. No, sir, I have that slide. I saw that
Yes,
slide.
yes, it was skipped slightly.
Yes,
Could not see it.
No, sir.
कितने देर तक
No, sir.
हाँ सुन के
I-
लिए वो एक्चुअली लेते लेते जाएंगे तब अपने को ध्यान आएगा कि वो क्या कहते हैं। स्क्रीनशॉट लिए अपने बहुत सारे।
Yes, ma'am.
Could not visualize, madam. Can you please
Here,
put that?
yes. Actually, na here is just minute. Seven.
Yes, ma'am.
Back.
Your last slide is visible. You can go back now.
Yes,
Back.
yes. Yes, this is. Sir, Subramaniam, sir.
Yes, madam. It is a
Hello.
urine examination. This one, madam.
Sir,
Yes,
this.
yes.
Yes. Now, sir, I was explain. Just a minute. I was explain urine physical examination, urine chemical examination. Are included. Here is a deep stick method, multi-stick method, urine test. This slide. Sir, hello.
Yes, madam.
Yes. This is physical examination. This is chemical examination, and these all urine examinations must perform by students, sir, because it is very important examination for us, for students. So physically they perform, chemically they perform. This is the multi-stick, and microscopically also they perform.
Yes,
मैम
madam.
अभी
Thank you.
स्टूडेंट्स के जो पुराने प्रैक्टिकल थे वो नए सिलेबस में नहीं है क्योंकि वी आर गोइंग विद
नहीं सर,
न्यू
अभी
टेक्नोलॉजी।
हम जो कर रहे थे सर,
हाँ,
yes, this is just
New
new
technology.
technology, because there is no use now. There is no use of
Yes,
our
ma'am, yes.
previous practicals. So students should know what is the mechanism, what is the principle of flow cytometry. What is exactly flow cytometry?
Yes,
Students should know, because when we ask them what is analyzer, what is the mechanism, they don't give the answer. So they must know. And both analyzers, biochemistry analyzer and hematology analyzer, at least they know the mechanism and principle of that analysis.
एक्चुअली ये काफी अच्छा चीज हुआ मैम, क्योंकि हमारी बहुत से लोगों की डिमांड यही थी कि ये पुराने
Yes, sir.
प्रैक्टिकल्स जो है इसकी कोई जरूरत है ही नहीं
कोई
अभी।
जरूरी नहीं थे, कोई जरूरत
करता
नहीं
नहीं।
थी सर, कोई करता
इससे-
नहीं था। तो ये बहुत अच्छा हो गया, क्योंकि हम मैनुअली तो करते ही नहीं है,
मैन्युअली कोई नहीं
तो
करता।
एटलीस्ट और वो खुद बुक के करेंगे तो they have confidence. And एक बार करके लिया तो confidence बढ़ जाता है तो करते हैं खुद.
इसी
Actually,
इसी तरह
the importance given for order and interpret. They should perform,
Yes,
but
ma'am.
they
Yes.
should know how to order and how to interpret each and every investigations.
that was very
So
important
just we focus on that.
regarding the
Yes.
subject.
Yes, sir.
Roganidan as well.
Interpretation is very important.
Yes, ma'am.
Yes, sir. Very important.
Another one doubt, madam.
Yes, sir.
Hello.
Yes, sir.
Yes.
Namaste.
Namaste.
Yes,
Sir,
sir.
regarding the practical exam of blueprint of practical exam,
Yes.
in that during the final exam, whether the student has to demonstrate these tests in front of examiner or only the case have to be given. It is demonstration. They have told that clinical examination on patient or stimulator. Lab it is not highlighted. Whether we have to make the student to demonstrate during the practical YOC during our final BM second year examination.
I think Zayu madam answered very well about this. Is Zayu
Actually,
madam is
they-
there?
Ma'am, actually, hello.
Because हाँ बोला ना सर.
Yes, sir. Dudmal sir.
बोला ना
Yes.
Yes.
Actually, they omitted the
Dudmal sir
practical
बोला.
from
Yes.
our final examinations.
Yes.
Actually, we
No,
have
sir.
to decide that
They
what
are
to
talking
do.
about demonstration.
Yes, I understand that.
They are talking about.
Actually,
Yes,
yes,
yes. They
we all
omitted,
said
but-
that the syllabus and scheme of the examination. They omitted the practical
Yes,
examinations from or pathological practical examination from the syllabus.
Yes, sir.
They
That is
omitted
the
Aha.
it,
that
yes.
is
They
Actually, it is
demonstration.
Yes.
Actually, it is depend on our how to take the examination. They are given the all the things, but omitted positively. I think I positively omitted the practicals of the Roganidan, as we traditionally performing, not giving any mark or weightage of the practicals.
That practical.
So we have to decide what to do
They give
in
them-
the examination.
Yes.
Actually, Zai
Demonstration
madam
here
is not
given.
there.
Demonstration
Yes,
here
Zai
given
madam.
only.
If you are there, please.
Jai ma'am.
Zai madam नहीं है क्या?
Join किए मैम अभी. तो लास्ट टाइम जो देखा था उसमें ऐसा था कि यू कैन आस्क स्टूडेंट्स टू यानी प्रैक्टिकल जो एग्जाम जो है उसमें आप अलग तरीके का एग्जाम ले सकते हो. लाइक जैसे उन्होंने दिया कि आरबीसी एस्टिमेशन है, तो जैसे हम लास्ट टाइम पहले करते थे या डब्ल्यूबीसी एस्टिमेशन, वैसा नहीं करना है. हाउ टू ऑर्डर वगैरह वही चीजें हैं, और कौन कौन सी चीज में बढ़ेगा वगैरह. तो ये
हाँ,
जय
वो
मैम एक
नहीं देखना पड़ेगा सर एक्चुअली.
हाँ,
और अब एक बार वो हाउ टू प्रैक्टिकल एग्जामिनेशन का जो पार्ट कौन परफॉर्म कर रहा है वो. एनीवन गिव द लेक्चर ऑन दैट पर्टिकुलर टॉपिक,
ओके.
तो हमें ज्यादा अच्छे से समझ में आ जाएगा टॉपिक.
अभी एग्जाम पैटर्न उन्होंने दिया ही नहीं ठीक से.
नहीं तो फिर देखना.
हम्म.
आई थिंक सिलेबस के एंड में दिया है शायद, अभी पढ़ना पड़ेगा वो थोड़ा.
Practical exam, madam. They are given in 3 headings. One is practical spotting and identification. That is, we have to keep 10.
Case taking.
Each carries 3 marks. It is 30.
Yes.
And the one is long case taking and examination. It carries 40. And the third one is demonstration. It carries 30. In that, they have specified clinical examination on patient or stimulator. Lab के बारे में कुछ नहीं दिया है.
हाँ. तो ठीक है सर, फिर अच्छी बात है. यस, बराबर है.
Syllabus. There are 4 points.
Yes,
Points
exam
actually.
से, yes. 40 दुधमल सर आपको याद है ना, 40 marks for long case, 30 marks for spot.
30 marks for demonstration on patient, long case, short case, either way. And then spotting is of 30 marks, in which 10 questions will be asked.
Okay.
think Manjiri madam will be more appropriate to focus on this particular issue.
हाँ सर, बीच में थोड़ी एक एक्टिविटी चल रही थी इधर, तो मैं जुड़ी नहीं थी. आई थिंक द क्वेश्चन इज रिगार्डिंग असेसमेंट्स, नो?
प्रैक्टिकल एग्जाम में
Question is
नहीं
regarding the inclusion of pathological experiment which is prior in the old syllabus. Now it is omitted. The question
So they are for spotting, sir, I think. And there we have to give the reports of the investigations, and they are expected to interpret the reports. We can give them the case scenario and ask them to order the investigations related to the case scenario given. So
Hello,
order
hello.
and interpretation. Huh?
नहीं नहीं मैडम बोला बोला
So
बोला।
order interpretation will be based on the case scenarios or the reports of the investigations given to the students in that specific station.
May I add something,
In the,
sir?
and in the clinical examination, based on the case taken by the students, the specific investigations they should be able to order. If there are the reports available with the case given, they should be able to interpret the reports with the case.
Yes.
Namaste,
this is
madam.
a nice
Manjiri
thing.
madam, namaste. Dr. Subramanya.
So just again the interpretation
Demonstration
is
के बारे में,
important.
madam.
Order and interpretation. Yeah.
Just
And
order and
demonstration.
interpretation. Yes. Again,
And
they
some of
focused
the
on order and interpretation.
some of the say heuristics methods you can give them to the spots.
Okay. Okay. Yes.
Yeah.
Yes. ma'am.
Madam, demonstration here, Manjiri madam, it is only for clinical examination or lab examination also. Third point.
Demonstration?
That is 30 marks last demonstration. That is clinical examination on patient or stimulator. Whether you have to give any practical to the student.
Clinical exam.
No.
Only
Clinical exam.
Lab का नहीं है. No lab performing.
Nice. Subramaniam sir,
Yes,
if
madam.
I am not wrong, अभी रिस्पेक्टेड देशपांडे मैम ने जो बताया है उसके ऊपर से मुझे कि हम वो जो साइमुलेटेड पेशेंट्स और लॉन्ग केस है वो तो बच्चों को ड्यूरिंग एग्जामिनेशन देंगे और प्रैक्टिकली हम सिर्फ इंटरप्रिटेशन ऑफ लैब इन्वेस्टिगेशन उसके ऊपर फोकस करेंगे एग्जाम में.
पहले तो हमको इधर
they will not perform the they will not perform the investigations, but order and interpretation is important regarding investigations in during the examination.
And which short small things which are the short practicals we can give them to the spots also.
Okay. Yes.
For example, using sticks and all these things or occult blood examination. We can give them for the spots also because they are just for a half a minute or we require for that.
Yes, ma'am.
Actually, madam, स्पॉटिंग के लिए टॉपिक दिया है और सब दिया है उसको और वेटेज भी ज्यादा दिया है 30 मार्क्स का.
ब्लूप्रिंट सब दी है. Blueprint is given in the spots.
Yeah.
95, 96.
Given the 10 questions and given the subject of that questions also.
Yes.
95 to 94 थी.
कौन सी स्लाइड रखने है, क्या करना है, क्या स्पेसिमेन रखना है, सब लिखा है
And
उन्होंने.
you can give the practicals them for the periodic assessments.
Okay. For 15 marks.
15 marks, yeah.
Yes, ma'am. Yes.
एक्चुअली इसमें पीरियोडिकल असेसमेंट के लिए क्या देना चाहिए इसका कुछ गाइडेंस नहीं है मेरे हिसाब से.
It depends on you. Which
guidelines.
Method we will give MCQ.
The topics. Based on the
we will give MCQ. We will give short questions.
Yeah.
Whatever.
Actually, not mention anything about periodicals.
Yes.
No.
Depends.
You can choose any innovative method also. For example, OSCE or OSPI, we can choose, or presentations, MCQs, SAQs. chart makings. You can choose any method.
Yes, sir. And OSCE or
Is it
OSCE, that methods we will use in spotting also. Zai ma'am discussed with us.
Not for spotting actually.
At that time in MBHS workshop, Zai ma'am just we discussed about that.
OSPI, you can use small stations.
Okay.
Actually, in the objective structure practical examination, they are expected to perform whole the practical.
Okay.
And in the OSCE, you can have some specific stations. For example, Nadi Pariksha or auscultation like this. You can have the stations for clinic OSCE.
Excuse me, madam. Namaste.
Varshniji, hi.
Manjari, madam.
Namaste, sir.
Yes, sir.
Sir, when will be the activity book will be available?
No idea, sir.
Students activity book.
Hello. Hello. Hello.
Zai ma'am, you are audible. Yes.
Actually, yes. Actually, I'm in a traveling. So, the thing is like first lecture which was scheduled by Dr. Shweta, one of the syllabus committee for all of the subjects. Am I audible? Am I audible?
Your voice is breaking. Your voice is breaking.
Yeah, my voice is breaking. Actually, very first lecture we scheduled from Dr. Shweta Taylor madam. She was one of the support for this coordination of NCSN syllabus committee, but due to some unavoidable circumstances regarding the work of MUHA, she was not able to give that time. But very soon we are going to schedule her lecture on the teaching learning methods for RN. And she is definitely elaborate and expected, and so many you can so in the next lecture it will be very clear how these all teaching methods should be used very practically and very conveniently. I know besides this Maharashtra group, everyone is feeling very much difficult to implement these all teaching learning methods as per expected by NCSM. But once we will get that clarification on that particular topic, it will be easier, I think. So just tomorrow or day after, we are going to keep our lecture, madam's lecture. So don't worry about it.
Thank you. Thank you, ma'am. Hello.
Yes, sir.
Yes. I
Hello.
think ma'am has resolved the queries. Yes, sir.
Sir, other departments, just I was going through the curriculum of other departments, Samhita and other departments. They have discussed, they have given the activity book. They have discussed that also, and they have uploaded the videos.
Sir, we are
Okay.
going to keep one separate lecture regarding activity book, but right now, you can say the notification through NCSN is awaited. NCSN head, they ordered us, all chairmen of all subjects, regarding the exact performance for this activity book and all, and it is awaited. Within 2 or 3 days, you will get officially, and after that publication, we will officially discuss on that particular topic of activity book, journal, demonstration, everything. Oh, sir, am I audible? Because I'm traveling and I don't think so.
Yes,
Voice
yes,
is
ma'am.
so
You are
clear.
audible, just your voice is breaking, but you are audible.
I'm putting a message.
Audible, ma'am.
I'm putting a message
Yes.
that we are arranging a lecture on the day about activity book and log.
Yes.
Okay, thank you, sir. Thank you very much. Yes, yes.
I think all the queries has been resolved. I'm very thankful to the platform that is Academy of Roganidan, President of ARN, Dr. Godotwar sir, then Secretary Dr. Atul Vashne sir. Zaikini ma'am has took initiative to conduct all the necessary lectures for this seminar about Roganidan UG syllabus. In this,
गणेश सर अनाउंस करना अपना फोर्थ हेलो
हाँ सर
रोगनिदान हाँ रोगनिदान
last
हाँ ओके
So in this context, we have first lecture on the practical assessment and all that. I very much thankful on the behalf of Academy of Roganidan that Professor Ujwala ma'am has accepted our request to take a lecture on this topic because there is much more confusion about how to conduct this syllabus in 1.5 year span. All the basic ideas which we are taking in lectures and practical since last like me, I have 10 years of experience. तो वो थोड़ा सा अभी चेंज होने में टाइम लगेगा. MUHS and NCSM is also taking initiative to publish an activity book and to resolve the queries. NCSM by the end of the December, I think they will November or December starting, they will publish activity logbook and other things. And one request, one announcement is there on 4th of November. There is Rashtriya Roganidan Divas, National Roganidan Day on the Foundation Day of Academy of Roganidan. So we are going to arrange a lecture on clinical importance of Madhav Nidana. As we always say that Nidane Madhava Sreshta. So the clinical application of Rognidana, a lecture will be arranged on the Academy of Ram from 11 a.m. onwards. Dr. Vivek Dubey from Bilaspur will give his lecture on this topic. So I request all the members to to join on the 4th of November. And regarding syllabus, we are arranging lecture on 6th of November by 12 p.m. on for Roganidan first paper. That will be by Dr. Badgi sir. And in between अगर मैम को टाइम मिलता है, श्वेता तिलंग मैम का जिनका पहला लेक्चर हमने रखा था डायग्नोस्टिक के बारे में, तो वो भी हम अरेंज करने की कोशिश करेंगे. 2 से 6 लेक्चर होने वाले हैं टोटल हमारे इसमें. तो जो भी हमारी क्वेरीज होगी आप ग्रुप में भी डाल सकते हैं या पर्सनली मुझे मैसेज कर सकते हैं, या जो हमारे रिसोर्स पर्सन रहेंगे उनको भी आप रिक्वेस्ट कर सकते हैं. ऐसे कोई दिक्कत का काम नहीं है. और रोगनिदान दिवस जो हमारा 4 तारीख को है, तो आप नेशनल रोगनिदान दिवस के संदर्भ में कुछ यस यस वेल अगर आपको कुछ एक्टिविटीज करनी है तो आप कर सकते हैं. एंड thank you very much to joining us, all the dignitaries, all the seniors, juniors and PG scholars who have joined this lecture. And on this note, with the permission of respected Vashne sir, I conclude today's lecture. Thank you, ma'am. Thank you very much.
Thank you, sir, for giving me this opportunity. Again, thank you.
Thank you,
Sorry
madam.
for inconvenience.